Shunt patients have a small liver or microhepatica. The liver does not grow to normal size due to decreased blood supply and the lack of a growth factor normally received from the pancreas. The shunt allows blood from the intestines and pancreas to bypass the liver. About 85% of shunts are extrahepatic portosystemic shunts to the caudal vena cava. The patient's bile acids will be greater than 80 micromoles per liter. One method of finding an extrahepatic shunt is to compare diameter of the portal vein, caudal vena cava, and aorta in a long-axis view. To find these structures, begin with the transducer in a ventral midline sagittal view of the liver at the xiphoid. Slide the transducer to the patient's right side and then fan back to the patient's left to find the portal vein at the porta hepatis. Small transducer movements are used to line up the extrahepatic portal vein, caudal vena cava, and aorta. On the ultrasound screen, the liver, extrahepatic portal vein, caudal vena cava, and aorta are seen. For color flow Doppler, use your lowest available frequency and turn down the two-dimensional gain. Color flow shows best with black pixels. If two-dimensional gain is too high, color flow will be poor. At the porta hepatis, the two veins and the aorta are almost the same diameter, about a 1:1:1 ratio. If the portal vein to aortic ratio is 0.8 or greater and the liver is not small, the patient will not have an extrahepatic portosystemic shunt. A patient with a portal vein to aortic ratio of 0.65 or less will have an extrahepatic portosystemic shunt. The extrahepatic portal vein at the portal hepatis in a shunt patient is often much smaller than the aortic diameter and may even be hard to find. The caudal vena cava at the porta hepatis in a shunt patient is often much larger than the aortic diameter. Follow the caudal vena cava caudally, with or without color flow Doppler, to see where the shunt enters the caudal vena cava. Measure the width of the shunt for possible surgical intervention. This video begins in a right lateral transverse position with color flow Doppler in a normal dog to show another method of locating a shunt. The right kidney is in the near field, the aorta is red and in the far field, the caudal vena cava is blue and to the right side of the aorta in the transverse view. As the transducer slides cranially, the extrahepatic portal vein appears in blue to the right side of the caudal vena cava, but these two veins do not connect. Extrahepatic shunts are usually major connections between the extrahepatic portal vein and the caudal vena cava or the general circulation. One method of locating a shunt is to place the transducer in a transverse plane on the right lateral wall of the abdomen and locate the right renal vein entering the caudal vena cava. As you slide the transducer cranially, no other major vessel should enter the caudal vena cava from the midline until you reach the hepatic veins, and there should be no connection between the caudal vena cava and the portal vein, which will appear ventral to the caudal vena cava. In some cases, a shunt may connect from the portal vein to the colic vein, renal vein, or azygous vein. A second method for searching for a shunt is to find the spleen in a transverse plane and follow the splenic veins to the portal vein. If a shunt is present, the portal vein would probably be enlarged and can be followed rather easily. Color flow Doppler can also be used to help follow the portal vein, in blue here, across the abdomen to the porta hepatis. Other veins may be seen flowing into the portal vein, but there should be no vessel leaving the portal vein. Blood flow in the caudal vena cava fluctuates with respiration because of varying intrathoracic pressure. Blood flow in the extrahepatic portal vein is normally protected from the effects of respiration by the capillary bed of the liver. With a portocaval shunt, blood flow in the portal vein may also show a fluctuating flow due to the connection with the caudal vena cava. Color flow or spectral Doppler can be used to show fluctuating blood flow in the portal vein and supports the presence of a shunt. In this video, a large, tortuous portosystemic shunt loops dorsal to the caudal vena cava and enters it near the cranial pole of the right kidney. The shunt flow is moving upwards, or toward the transducer, and therefore is read with color flow Doppler. Portal hypertension is not present with congenital portosystemic shunts. In this right lateral transverse transducer position of the same dog, the shunt appears in red to the right side of the aorta and then moves ventrally to join the caudal vena cava. Remember, in a ventral sagittal view of the normal liver with color flow Doppler, the portal vein and caudal vena cava do not connect. This video begins with a still of a sagittal view of an intrahepatic portosystemic shunt in a 3-year-old spayed female Brussels Griffon. Note the small liver. Intrahepatic portosystemic shunts tend to occur in large breed dogs, but can also be seen in small dogs or cats. In these shunts, the portal vein may be described as left divisional, central divisional, or right divisional, depending on how the portal vein connects to the caudal vena cava inside of the liver. In this case, the shunt is a central divisional or window type connection between the intrahepatic portal vein and the caudal vena cava. This connection is also visible in a transverse view. In a right lateral transverse view of the normal liver and major blood vessels with color flow Doppler, the aorta is red and to the left. The caudal vena cava is blue and in the center of the far field. The intrahepatic portal vein is to the right of the caudal vena cava. The caudal vena cava and the intrahepatic portal vein do not connect. This right lateral transverse view of the liver shows an intrahepatic portosystemic shunt. The caudal vena cava at the dorsal liver connects directly to the intrahepatic portal vein. With chronic liver disease, hepatic fibrosis, or cirrhosis, blood flow through the liver becomes obstructed and portal hypertension develops. Portal hypertension causes the development of multiple microvascular portosystemic shunts to relieve the hypertension. These shunts will not be visible on ultrasound, but the extrahepatic portal vein becomes enlarged and tortuous due to portal hypertension. In dogs, the liver becomes small, nodular, and hyperechoic. In cats, the liver will be hyperechoic, but normal to mildly enlarged in size. Portal vein hypoplasia was previously known as hepatic microvascular dysplasia and is 15 to 20 times more common than shunts. On ultrasound, the liver is usually normal in size, shape, and appearance. Affected animals have a partial lack of development of intrahepatic portal veins, and all patients will have elevated bile acids, but less than 80 micromoles per liter. Color flow will not show a lack of intrahepatic portal veins. It is possible to have portal vein hypoplasia and shunts as well. Portal hypertension is usually present and microvascular portosystemic shunts develop. Diagnosis is confirmed by surgical or laparoscopic liver biopsy. After years, the patient develops a compensatory increase in the number of hepatic arteries of the portal triads. Scintigraphy will show microvascular shunts. Up to 50% of shunt dogs will have renal or bladder stones.